You can start.
Is my screen visible?
Yes, yes.
Yes. Hello, everyone. Myself, Dr. Arundathi, a clinical microbiologist, here today with you all to make your journey of microbiology a relatively an easier one in your NEET PG preparation. So let us begin today's session without delay, where we will take up a PYQ based discussion with a case study where this case study in turn leads us to various other topics which are commonly asked in various entrance exams. So here we can see a case of a 32-year-old male who was brought to casualty with complaints of fever, headache, vomiting, and altered mental status for a duration of say 3 days. And on physical examination, they noticed there was neck rigidity, and CSF analysis revealed a really increased cell count of 58,000 plus cells, where predominant cells, that is 85%, were neutrophils. And we can observe there is a marked decrease in glucose concentration, increase in protein concentration. So they have also provided with a microscopy of the CSF sample, and they want us to answer about what is true about the causative agent. So if we look at these options, we can observe that the question basically deals about the cultural characteristics and the biochemical characteristics of the agent. And we have been provided with a microscopic picture of the CSF as well. So if we look at this particular case, just by looking at the case where the patient's primary features, that is fever, headache, vomiting, and altered status, where fever is the marker of inflammation, our headache, vomiting, and altered mental status, which means there is increased intracranial pressure, means that we are dealing with a clear-cut case of meningitis. So we have a case of meningitis where we will have to diagnose the causative agent of meningitis. So here we have been provided with an image which looks full of pink and blue. And in microbiology, a microscopic picture of pink and blue. No need of any mnemonics. Do not buy at any mnemonics. We have studied for whole 1.5 years about this. It is a picture of nothing but the gram stain. So we are here dealing with an image of gram stain where we have been provided with the CSS analysis thing. And there are many pink structures, and we know that anything in gram stain, if it is pink, it means it is gram negative. Anything which is violet or blue, it is, the meaning is it is gram positive. And if they are spherical, they are called as cocci. And if they are rod shaped, obviously they are called as bacilli. All these things we know to a greater perfect extent. So here, if you visualize this particular image of CSF sample, we can see that there are a lot of pink structures which are nothing but your pus cells, where we said that there are about 58 plus thousand pus cells. So all these are your pus cells. And along with the pus cells, we have these structures which are violet in color, therefore they are gram positive. They are spherical in shape, therefore they are cocci. And they are arranged in group of two, therefore they are pairs. So what we have a CSF picture which is a gram stain picture showing gram positive cocci which are arranged in pairs. Therefore, when we look at a case of meningitis where we are clearly given a picture of gram stain showing gram positive cocci, we can directly narrow down to the diagnosis by looking at the morphological feature of the organism if we are thorough with this particular flow chart. So the causative agents of meningitis we can study under the following if they are bacteria. GPC means gram-positive cocci, which is a Streptococcus pneumoniae and Streptococcus agalactiae, where a Streptococcus pneumoniae are GPCs which are in pairs, which are the causative agents of pneumonia. This is the most commonest cause of meningitis. Streptococcus agalactiae, this is gram-positive cocci which are arranged in chair. So do you remember the Streptococcus agalactiae anywhere? Have you heard where it is present? Yes, you will have to think where your Streptococcus agalactiae is present in maternal birth canal. Therefore, when a baby is coming out of birth canal, this can result in meningitis in whom? In the newborn. So, in neonates, if meningitis is seen, then the most commonest agent is this particular Streptococcus agalactiae, which are gram-positive cocci in chins. Then, yes, we have gram-positive bacilli. The only gram-positive bacilli which results in meningitis is Listeria monocytogenes, where this Listeria monocytogenes mainly causes meningitis in immunocompromised individual. So usually if we have any case of meningitis where the diagnosis is Listeria, what all things can you expect in a question of meningitis towards Listeria? You can expect a history which speaks about the patient is immunocompromised in terms of any transplantation, or the patient is on some immunosuppressive drugs, or the patient is at extremes of ages, that means either newborn, or the patient is either elderly, that is 60 years and above. So if something like this is there in question, then the first thought should be about Listeria monocytogenes. Then we have gram-negative cocci. A cocci again which is present in pairs, and yes, can you please think and tell me gram-negative cocci means what color it should be? Obviously, it should be pink in color, and these are pairs where they are half-moon shaped pairs which are capsulated cocci. And these Neisseria meningitidis, when a case of Neisseria meningitidis is as something which will be usually also seen in a case is rashes in the patient. So if there is a case of meningitis where they also say that on examination patient showed rashes on the body, the diagnosis you can narrow it down to Neisseria meningitidis. That should be your first thought because it causes rashes when it is resulting in meningitis. The GNB, which is a causative agent of meningitis or H influenzae, actually now the cases have decreased because of vaccination. Which vaccination is present for H influenzae? It is B, Hib B, that is your B serotype is targeted. The others are Escherichia coli, and name any GNBs that you can remember. It can be Klebsiella pneumoniae, it can be Proteus, Pseudomonas, Acinetobacter. Anything that is present in hospital can cause infection in immunocompromised individuals. So to again revise this, so if at all in a question we have a morphology of an organism, we can narrow down to the diagnosis because there are only two cocci which can cause meningitis, which are gram-positive in nature. One is pairs, the commonest agent. The other one which causes infection mainly in neonates. Then there is only one GPB, only two GPCs, only one GPB, that is Listeria monocytogenes. Usually it is the agent which causes meningitis in immunocompromised. We have only one GNC, that is gram-negative cocci, Neisseria meningitidis. What can you expect in a question? You can see something which is the rashes on patient's body. Gram-negative bacilli, less commonly seen, more common in a hospital setting. It can be H influenzae, Escherichia coli, or gram-negative bacilli. If it is a case of H influenzae, you can expect something even about satellitism, either in the question or in the choices. So I want you all people to go back and revise about satellitism in H influenza. So this is how we narrow down if we are given about the morphological feature of an organism. So here in the same case, let us just think that we are not given this particular image, and we are just given this question without the microscopic feature. So is it difficult for us to narrow down the DDs? No, not certainly, because there are numerous hints in the questions, which again helps us to narrow down. So what are those hints apart from a microscopic picture? There is one more hint in this diagnosis itself, that is the biochemical analysis of CSF. How this will help us, let us see. And apart from that, I would also like to stress upon the age of the patient. So these two are other hints which drive us towards the diagnosis, that is the biochemical reactions as well as the age of the patient. So let us look into how these two drive us towards the diagnosis. So the biochemical reactions, where we speak about the neutrophil count, where we speak about the protein and glucose content, one thing that we should remember is in bacterial meningitis, everything is exaggerated. Everything is too much abnormal in nature. Just remember this. Do not break your head thinking about anything else. In terms of what? In terms of what it is abnormal? In terms of WBC counts. If you can see here, it can go up to 10,000, sometime lakh. So your WBC count is too much increased, where the main cell, the predominant cells are neutrophils. Whenever bacteria invades our body, neutrophils will be poured like anything in the system. So neutrophils are the first thing to enter in bacterial infections, and they are too much increased in bacterial meningitis. So obviously, when there are so many neutrophils, so they want something to live, right? They want something to thrive. So what will they consume in CSF? They consume this glucose. So what should happen if so many neutrophils are consuming glucose like anything? Obviously, glucose should decrease to a greater extent. So again, do not mug up. Do not follow mnemonics. You will have to follow mnemonics for n number of things. So where you can reason, where you can remember in a easier logical way, please don't follow mnemonics. So here, when the cells are increased to this greater extent, obviously they want food for them, and that is glucose, and therefore glucose is decreased drastically. So what two things do you remember in case of bacterial meningitis? Your WBC counts are increased to a greater extent, where the main cell type is neutrophils, and obviously this neutrophils, to live, to thrive, they require glucose, and once it starts consuming glucose, the glucose is drastically decreased. So these 2 points should be remembered in bacterial meningitis. Coming to tubercular, is almost like bacterial, but the variation is not to a greater extent. So it is a little increase, little decrease. So that's all in tubercular meningitis. But the point which favors tubercular meningitis is the appearance, the color, not just turbid, it will be xanthochromic. What do we mean by xanthochromic? It is straw colored. So just how your urine looks. So the same yellow color like urine it looks, and they form what is known as cobweb because of increased fibrin content. So the main thing in tubercular meningitis is CSF will be xanthochromic, means it is like your urine, the straw colored CSF, and sometimes there will be formation of cob like webs because of high fibrin content in this particular CSF sample. Viral and fungal we can categorize as others, where see, your biochemical reactions will not lead us anywhere. We cannot narrow down to anything in viral and fungal meningitis just based on biochemical reactions. So biochemical reactions most important for bacterial, followed by tubercular, where we will get a hint about what is it, and we can begin with a empirical therapy. So this is about how we can narrow down based on our biochemical analysis. So next, I also said that not just biochemical analysis, the age of patient also matters a lot for us, because once we get to know it is bacterial meningitis, looking at the cell count, looking at the patient's age as a clinician, I can start a treatment, because we will know what are the commonest agents in different age groups. So let us categorize for all practical purposes into 3 categories. The very first being neonates. So in neonates, obviously, infection should be caused by an agent which is present in maternal birth canal. So in birth canal, the organism, if it is there, that can result in meningitis. And we know that Streptococcus agalactiae is present in birth canal. So do you remember any particular test that we do for Streptococcus agalactiae? We take one swab from birth canal and we do some test, which is a common question asked again and again. Do you remember? Yes, very good. So the answer is your CAMP test. So Streptococcus agalactiae revolves around this CAMP test where your Staph aureus is used. And yes, let us not go in detail because it deviates a lot. So this is how you do CAMP test. So you get arrowhead shape hemolysis. This is your CAMP test done for Streptococcus agalactiae. So others are because of the lower immunity. So baby has not yet developed immune system, not yet started forming anything which can fight against infection. Therefore, these two are the agents which results in neonatal infection because of low immunity. GNB, that is E. coli. Listeria monocytogenes, which is again a food-borne pathogen resulting in meningitis. One easy way to remember that is Bell. So B stands for group B streptococci. If you can recall, Streptococcus agalactiae is also called as group B streptococci. B stands for group B streptococci, E for Escherichia coli, L for Listeria monocytogenes. Causative agent of neonatal bacterial meningitis, Bell. B, E, L. L Listeria, E Escherichia coli, B group B streptococci. Next, let us say from after neonatal age group till say about 50 or 60 years of age in a healthy child, in a healthy adult, the commonest agent is Streptococcus pneumoniae. Till date, the commonest agent is Streptococcus pneumoniae, followed by Neisseria meningitidis and H. influenzae. We have discussed little about all of these. Next, the elderly or immunocompromised patients, the commonest causes, again, Listeria monocytogenes, which again we saw in a previous slide, followed by all other agents which can cause infection in other age group. So neonates, commonest is Streptococcus agalactiae. Children and young adults, common is Streptococcus pneumoniae. Elderly, immunocompromised, it is Listeria monocytogenes. So, can you try and recall anything about Listeria monocytogenes? Something really important where numerous questions are asked about Listeria monocytogenes. I really want you people to think a lot about it because it has few special characteristics. The very first thing is it is a gram-positive bacilli. The second thing is it is a motile gram-positive bacilli with what is called as tumbling motility. Third thing is very, very unique for this organism along with few others is what is called as differential motility. So differential motility is they are motile at a particular temperature but not motile at another temperature. This is called as differential motility. So a case of Listeria monocytogenes, it will be a case speaking about immunocompromised patient. Let us say a transplant patient on immunosuppressive drug. The organism on microscopy showed tumbling type of motility and also it showed differential motility. Then the only choice you can think about is Listeria monocytogenes. So this is about how we can come to diagnosis based on the age group of the patient. Fine. So next, if we just recall the question, I really don't want to go back to all those slides. Should we really look at the slides? Okay, so we will again look at the slides, no issues. So our question slide where the options were regarding the biochemical reactions of an organism, that is what was the growth on blood agar and other biochemical properties. So this really requires us to go in depth about the organism that we have suspected. So what is the organism that we suspect? So it is Streptococcus pneumoniae. So let us study little in depth about Streptococci. So if you can recall, your Streptococcus pneumoniae belongs to Streptococcaceae, where your Streptococci based on growth on blood agar. So we classify into alpha hemolysis. The meaning of alpha hemolysis? Yes, it is partial hemolysis. There will be green discoloration around the colonies. That is alpha hemolysis. Beta hemolysis is complete lysis, that is beta hemolysis. No hemolysis, also called as gamma hemolysis. So streptococci is primarily classified based on how they grow on blood agar. Alpha hemolysis partial, beta complete, no hemolysis is gamma hemolysis. So what are the organisms which shows alpha hemolysis? Yes, I will draw alpha like this. And yes, alpha hemolysis, the example is pneumoniae and viridans. So you can remember like this, or else you can mug up. So pneumoniae and viridans are the organism which belong to streptococcaceae, and they are form alpha hemolysis. So next we have beta hemolysis, where the beta hemolysis producing organism is step pyogenes, which mainly results in your pharyngitis, your glomerulonephritis, which results in your rheumatic heart disease. And okay, so and step agalactiae. So we spoke really good things about streptococcus agalactiae, which you all know now. No hemolysis. Yes, no hemolysis is enterococcus. So this is how I want you to show enterococcus, where it is a diplococci, which is spectacle shaped. So spectacle shaped diplococci is your enterococci. So this is the classification of streptococci: alpha hemolysis, viridans streptococci, then and streptococcus pneumonia, beta hemolysis, streptococcus agalactiae. Then we have no hemolysis or gamma hemolysis is enterococci. So this is streptococcus viridans, the first image, where they are gram-positive cocci in long chains. What do you mean by viridans? Is it single organism? Can you name any organism? What does viridans cause? Yes, viridans is not a single organism. They are group of organisms which have few similar characteristic feature commonly present in your oral cavity. So they are viridans streptococci, mites, durans, many such one, where they are group of gram-positive cocci in long chains which are commonly present in your oral cavity. This is the image of streptococcus pneumoniae. You can see gram positive cocci, which are mainly in pairs. Then we have streptococcus pyogenes. Your pyogenes, viridans, agalactiae all look almost same because they are in chains. And this is what I was telling about CAM test, a characteristic test which you do for streptococcus agalactiae. Then hereby we come for enterococcus, again a gram positive cocci which are in pairs. Almost you get confused with pneumococci, but there is one biochemical reaction which differentiate this pneumococci and your enterococci, that is your bile test. So bile test, where the test tube will be turned into black color. So if any question is given with this black color test tube, gram positive cocci in pairs, it is enterococcus. It is not your pneumococci. So this is the classification of streptococcus pneumoniae. Fine. Okay. So again, I think I want you to see again and again so that you will never forget when I ask again. Okay, so this is about the morphology of Streptococcus pneumoniae. So Streptococcus pneumoniae, as I already said many times, they are gram-positive cocci which are in pairs, which is capsulated. So how are these gram-positive cocci shaped? They are lanceolate shaped, or they are also called as flame shaped. You just light a deepa. So how the flame will burn? So this is called as flame shaped or lanceolate shaped, where two cocci are together with a capsule. So can you all please try and recall where we have studied about this particular capsule of Streptococcus pneumoniae? It comes in your genetics. Can you recall that? So this is how you are supposed to prepare for NEET PG, where you should not get confined to that particular question. So whatever comes in your way, try to recall and reconnect it so that you will cover lot many things in just one question. So if you can recall in genetics, do you remember about mice pathogenicity test, which was done by scientist Griffith? And this was called as what? Griffith experiment. So Griffith did an experiment with capsulated and non-capsulated pneumococci, and he showed something called as transformation. So this is also a commonly asked question in your NEET PG, where Griffith experiment was conducted with which organism? Capsulated and non-capsulated Streptococcus pneumonia. You can just throw any organism as other choices. So the answer is capsulated and non-capsulated Streptococcus pneumoniae. So the morphology is gram-positive cocci in pairs, which is capsulated. When I'm telling so many times about capsule, that itself should make you realize that that is the main virulence factor. The organism survive. It causes so much havoc because of its capsule. Therefore, in previous time, this capsule was used as the primary diagnostic thing, where a particular test was done where capsule was detected. And this test, if you observe here, you can see that the capsule of the organism is swollen. How can we make something being swollen in an organism? By adding antisera. What we did, we took patient sample, we add antisera with a dye, methylene blue dye was used, so that it gives some contrast. And when we looked at it, obviously when organism reacts with antisera, it bulges. So this particular capsule bulged. And what is this experiment called? So can you recall? So this particular experiment or diagnostic test, where your capsular material, the capsule of the organism, has bulged because of using antisera, and methylene blue function is just providing a contrast, is your Quillang reaction. So Quillang reaction is used to demonstrate capsule of an organism. So this is about the morphological feature of Streptococcus pneumoniae. So how does that cause disease? So this particular organism is normally present in your nasopharynx, commonly in children's nasopharynx. And the other person gets infection by droplets. So it is a droplet-based infection from the carriers. Usually the children who are the carriers, from them through droplet we get the infection. And when one's immunity decreases, it results in diseases directly spreading to the nearby structure. So it is in the nasopharynx. Obviously, it can go to the lungs or to the ear canals or the sinus, resulting in pneumonia, otitis media, or sinusitis. All these are called as non-invasive manifestations. But along with this, it can also go to blood and result in bacteremia. What is bacteremia? Bacteria in blood is called as bacteremia. So the organism is in nasopharynx. From nasopharynx, the organism has entered into lungs to cause pneumonia, or it can result in sinusitis, otitis media. And what type of pneumonia does it cause? Can you all recall what type of pneumonia does the pneumococci cause? It causes lobar pneumonia. So what is the characteristic feature of lobar pneumonia? There will be sputum production, and in pneumococci, it is rusty sputum. So can you recall any other organism which produces rusty sputum? Yes, it's a parasite. A parasite infecting lung, which is called as lung fluke, also called as Paragonimus westermanni. So this Paragonimus westermanni also produces rusty sputum. So rusty sputum are produced by two organisms, that is your pneumococci and Paragonimus westermanni. Okay. So that is about pneumonia. Once it enters blood, so will it just sit in blood? No, obviously blood travels throughout your body. Therefore, even this organism travels in blood to all your parts and results in suppurative infections like arthritis, osteomyelitis, peritonitis, pericarditis, and whatnot, all itis. And importantly, it causes meningitis. So usually your meningitis is secondary to your bacteremia. So from nasopharynx, non-invasive to nearby structure. Invasive means it enters the bloodstream, bacteremia, meningitis, or any other septic disorders. So this is about the pathophysiology. So in diagnosis, it obviously depends upon what infection the patient comes to us with. If at all, if it is meningitis, obviously CSF is the sample. After microscopy, we go for culture. This is a picture of blood agar where the organism has grown. And if you can identify what we spoke so much about the organism, it is alpha hemolysis. So do we have alpha hemolysis as all this green discoloration that you are seeing? What is it? Alpha hemolysis. Greenish discoloration is alpha hemolysis. But not just that, please observe these colonies where there is a peripheral bulging and central depression. Can you relate this to anything that you use in an indoor game? So is it looking like a carom coin? Yes, no, it is looking like carom coin. So the colonies produced are carom coin appearance, also called as a Draughtsman colony. So you get characteristic Draughtsman colony in case of Streptococcus pneumoniae. Again, a question for you. So nothing may be given. A case of lobar pneumonia with this image can be given, which with additional questions on Streptococcus pneumonia. But why does it result in this kind of colonies? Because it produces enzyme which called as autolysin. So called because the organism lyses itself. Auto means what? Itself. Lysin, lysis. The organism lyses its own cell wall. Therefore, it is called as autolysin, also named as amylase. So what did we learn here? So we understood that this particular Streptococcus pneumoniae produces alpha hemolysis. It also produces carom coin appearance or Draughtsman colony. It is because of autolysin, also called as amylase. So this is a clinical characteristics of, cultural characteristics of this organism. So not just that, always these cultural characteristics will not be very obvious and you cannot narrow down to the diagnosis. So obviously we will go for some biochemical reactions. And as we know, both strep pneumoniae, So both this strep pneumoniae as well as viridin streptococci, what hemolysis does it produce? What does it produce? Yes, it produces alpha hemolysis. So definitely we will have to differentiate between an organism which is producing alpha hemolysis. Very first is, yes, when we do microscopy, one will be in pairs, other will be in long chains. But this is not very important because what happens is the pairs, no? So these pairs, they will be next to each other. The pairs will join together to form long chains. That is the hurdle for us to diagnose just based on the microscopy. So we depend on biochemical reaction where this particular Streptococcus viridans and pneumoniae is perfect, P for P, in its biochemical reaction. What does biochemical reaction stand for? I will tell you. Whereas viridans is worst in biochemical reaction. So P for perfect, V for worst in biochemical reactions. What does bio stands for? Bio stands for these. B for bile solubility, I for inulin fermentation, O for optochin sensitive. Perfect means everything is positive. It is soluble in bile, it ferments inulin, it is sensitive to optocin. Is that clear? So how do we remember this biochemical reactions? So your pneumoniae is perfect in your biochemical reactions. That is bile solubility. That is, if you add 40% bile, the organism gets solute. That is, it just dissolves because of autolysin, inulin fermentation. What do you mean by inulin? Do you know what is inulin? Inulin is a sugar. Okay. So there are many questions on this also where many questions are asked saying, what is true about pneumococci? Pneumococci ferments glucose, ferments maltose, but not inulin. It ferments inulin, but not glucose maltose. So just a game revolving around various sugars. The answer is Streptococcus pneumoniae, it ferments most of the sugars, around 38 to 40 sugars it ferments. So don't worry at all. Whatever sugar they give, it ferments, because most commonly glucose, maltose, sucrose, fructose, all these are commonly used sugars. All the sugars it ferments, and inulin is the one which differentiates with other streptococci. So it is biochemically perfect, bile-soluble, inulin fermented, and optochin disc susceptibility is susceptible. So that is how we differentiate between pneumococci and viridans streptococci. So this is our optochin disc susceptibility. Actually, it is OP, not P. So we place a disc which is optochin after doing a lawn culture half and half. S mitis, I think you can remember me saying about S mitis when I spoke about viridans. S mitis comes under viridans group. So it is resistant to optochin. So please note it is OP. The disc is OP. So this is OP disc. So Streptococcus pneumoniae. Can you see the zone of inhibition? There is a large zone of inhibition, more than 14 mm, which means it is susceptible to optochin. So this is the biochemical reactions of our Streptococcus pneumoniae. Okay, so this is how we can summarize Streptococcus pneumoniae. So Streptococcus pneumoniae, very firstly, it is a gram-positive capsulated diplococci. What shape? It is flame-shaped or lanceolate shaped. How are we going to see for the capsule? Quillung's reaction, Quillung's reaction. Anything else about capsule? Yes, we have Griffith experiment. You can add on. So I have provided your mind map. Please add on to this mind map, and this one particular slide is more than enough for whatever we spoke for almost 20 to 25 minutes. So just this slide is enough. So gram-positive capsulated diplococci, lanceolate shape, where Quillung's reaction is done. Then cultural characteristic, alpha hemolytic colonies, Drotzman colonies. Why there are Drotzman colonies? Another question. Because of photolysin or amylase. Biochemically, it is perfect, means it is bile soluble. Inulin is fermented, optochin susceptible. Don't just mug up inulin. They may not only give inulin, they may give any sugars. Please don't worry about any sugar. It ferments 40 sugars. So most of the sugars are fermented. And then, yes, what all it causes? Mainly it causes lobar pneumonia. In lobar pneumonia, what you should remember, it causes, produces rusty sputum. It results in meningitis, where you should know that it is the commonest cause of meningitis in healthy children and adults. And there's something which I did not touch upon, where I want you people to work on are the vaccines for it. We have basically 2 vaccines. So please go back and study about pneumococcal vaccine. So this is about pneumococci in total, where you can remember pneumococci just by this. So if at all, if we will have to go back to our question, yes, we can go back to our question now and answer the question. Please answer this question. So we know it is Streptococcus pneumonia. Does it produce beta hemolysis? As soon as you see
Doctor,
beta
sorry to
hemolysis,
interrupt. We have less than 20 seconds, so please wrap it up.
okay, then
Yeah.
finish. So as soon as you see alpha hemolysis, yes, obviously you should open your eyes brightly. And the next option, part